In embolic stroke, you can have territorial medial cerebral artery infarction or small embolic lesions, very often located in the watershed area between the anterior and the medial cerebral artery. In this location, the hand areal is located, and that's why patients with embolic stroke very often complain about symptoms from the hand. Clinical presentation can be like this, with an extension of the fingers, and it's sometimes difficult to differentiate to the radialis paresis. Patients, they speak to you and they tell you, I can't move my hand properly. But you never be sure if stroke comes from the heart or it's related to carotid stenosis. In the age of 70 years, you have a 15% chance to find a patient with a higher than 50% graded carotid stenosis, and you do have in the age of 85 a 10 to 15% chance to develop atrial fibrillation. So both disorders are very common in older people. So let's look at atrial fibrillation first, and from the Framingham study we know that with atrial fibrillation your annual risk to develop stroke is about 4% per year. And that's clearly age dependent. In the old aged people you have a higher risk to develop stroke due to atrial fibrillation than in the younger patients. In asymptomatic carotid stenosis, your annual risk to develop stroke used to be 2 to 2.5% per year. In this study published in Stroke 2010 from Marquardt, you can see annual risk rate of stroke according to studies within the former days and actually now. And you see that before 2000 there was a really high risk related to a high-grade carotid stenosis. That was above 2%. And in studies later on you would find a decreased risk rate below 1% per year, and that could be due to modern medication, especially due to statin therapy. Marquardt, with a very small number of patients examined, found a risk below 0.5% per year for patients with high-grade carotid stenosis. So thanks for your attention. I wanted to show you that embolic strokes very often affect the hand areal, which is located in the watershed area between the anterior and the medial cerebral artery territory. I have shown you that atrial fibrillation and high-grade carotid stenosis are both very common in old patients, and that with modern medication the annual risk to develop ipsilateral stroke in high-grade carotid stenosis is decreased in comparison to former studies.